It's a Northwest Lifestyle Weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
All right, segment number 2 of our show today as we continue with IRG Physical and Hand Therapy's Health Talk. And our first guest is Hazel Borden. Hazel's the Community Outreach Coordinator at Alzheimer's Association of Western and Central Washington. And Alzheimer's awareness, Shannon, it's something we have become more aware of, unfortunately, as more and more of our friends and relatives and people we know start to exhibit the symptoms of this. And that's, I think, what we're going to talk about today is kind of how we recognize that in our loved ones.
Well, just recognition of the disease and then just the support that families, Tom, we all know someone who has a family member who's experienced dementia or Alzheimer's, and it takes a toll on everybody involved. It's a challenge.
All right. Let's get that conversation started. Here is Hazel Borden and Shannon O'Kelly on Como.
Hazel, welcome to Health Talk. Man, how are you doing today?
Doing great.
It's so nice to have you here, and you work in community outreach and coordination in Snohomish County with the Alzheimer's community for the state of Washington. But I'm interested to find out, offline we were talking a little bit, you have an MBA. How did you get involved in outreach and coordination with the Alzheimer's Association of Washington? Interesting story.
Right. That's a great question. I'm really glad you asked because, right now there is an estimated 5.7 million people that are living with this disease. And they say that for every person that is diagnosed with this disease, you truly need a village. And that village equates to about 16.1 million Americans that are providing caregiving hours at without being paid, unpaid caregivers. There's 16.1 million Americans that are providing this care. So that is my personal journey, is that of being a caregiver.
Oh, okay.
Yeah. So now I myself am not a caregiver for somebody with this disease. However, I understand the caregiving journey through a child who has some severe medical conditions. So I have been in the shoes of those individuals who have had to put their career on hold, who have had to give everything of themselves to provide that, around-the-clock care for their loved ones. And so I left the corporate world to come and work for a nonprofit organization such as the Alzheimer's Association so that I could help connect those families in our communities with the proper programs and services because I know how important it is.
And based on your personal experience, talk about knowing how important it is. When you live it and you're day-to-day involved in it, it's scary. These numbers in Alzheimer's and dementia are staggering as our population gets older. As a physical therapist, we're doing a lot of stuff with exercise and brain health.
Yes.
We know that's biggest fear for people as they age is their cognition. Because, you can't really, when you lose it, someone has to care for you.
Right.
It's big stuff, but also big resources out there and help is out there for folks, right?
Yes, they are not alone. However, the sad part here is that if I had a nickel or a dime for every time I hear somebody tell me out in the community, if only I knew then what I know now, is that the Alzheimer's Association is here. We have a 1-800 helpline number that can be accessed 24 hours a day, 7 days a week. We've got social workers that, can help individuals navigate this disease. We've got lots of programs and services that are available for individuals that are on this journey. So yes.
And if you're on this journey, there's a lot of research being done. Can you talk a little bit about the diagnoses and kind of the help? Because, a lot of parents now are living on their own and sometimes they're living independently and maybe someone's not around or someone's not there daily to check on them. And a lot of times people, including myself, I think it would be difficult for me to maybe say to my family or my doctor, I'm having a hard time mentally. I don't think that's a comfortable conversation that people are honest about maybe some slowing down in cognition. You know what I'm saying?
Right. Well, all great questions and, all really important to address. And if it's okay, I would like to back up and start off, with the true definition of what is Alzheimer's disease.
Please do.
Because there has been a stigma on this disease for so long. For so long, this has been looked at, as grandma or grandpa's going crazy.
Yeah,
you
right,
know,
right.
And we don't talk about it.
Right, exactly.
And even in today's society, you know, myself being of Hispanic descent, being of, you know, one of those demographics that has a higher risk for this disease, even to this day, my parents don't want to talk about this disease. So let's break the stigma. Let's talk about this because, again, it's one of those where there may even be some physicians in our communities that don't know that there is no difference between Alzheimer's and dementia.
We'll continue our conversation on Alzheimer's with Hazel Borden and Shannon O'Kelly. That's coming up right after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
We're back with our conversation on Alzheimer's. Hazel Borden and Shannon O'Kelly.
Hazel, again, thank you for joining us on Health Talk. We were talking about Alzheimer's versus dementia, kind of a scary topic. What's the difference?
So there is no difference. The term dementia is the overall umbrella term. Okay, so it's similar to the word cancer. When somebody says the word cancer, you say what type. There's thousands of types. We can compare that to the word dementia. There's over 70 different types of dementias out there. Alzheimer's disease is the leading cause of dementias. So this is exactly why it is important to have a really good diagnosis on this disease and to work with your healthcare provider on addressing this. Now, what a lot of people don't know is that there is now a billing code that can actually be used with your healthcare provider through Medicare so that they can provide you with an extensive consultation to set that baseline to track you. And that billing code is 99483, because in the past, physicians weren't able to bill for that extensive time. Now they can.
That's really good news. It's so important. I mean, this is a situation that could, you know, economically, it could be a challenge for our country. I mean, with the number of people being diagnosed. Hey, hang on, just a minute. I got to ask, how does a person with a background in an MBA have so much knowledge? I mean, your passion and your compassion to this disease is obvious. I mean, tell our listeners how you and your organization can help them, because I think this diagnosis comes home and it's devastating throughout it ripples through the family.
Yes, it really does, you know, and that family journey is exactly what we are there to help families with. The Alzheimer's Association does a lot of work, not just within our communities, you know, one-on-one and hands-on, but also on the legislative side, which is why we're also a part of a Dementia Action Collaborative that is currently working on helping set standards and policies for diagnosing this disease in medical clinics. It also has put together a dementia roadmap for families. You can go online and you can Google Dementia Roadmap Washington State, and it will take you to this amazing map. It's literally a map that tells families what every stage of the disease is, what does it do, what to expect, and the great piece about this particular roadmap is it gives families a checklist at every stage of the disease that tells them what are the affairs that they need to get in order, whether it be legal, financial, healthcare planning, that can allow them to check that off before the disease progresses and their loved one can no longer be a part of that planning.
That good information. Hey, as we wrap up here, because this is a one-day topic, probably a one-week topic, we're trying to do it in a segment here. Early signs. What should we look for if our parents, or maybe we only contact them by the phone? What can we listen for as far as early signs?
So tricky when you're just on the phone, because as human beings, we are so amazing at hiding it and disguising it. But definitely forgetting old memories and forgetting and misplacing things, forgetting place and time. And some individuals lose recognition of their loved ones. So agitation, confusion, these are all signs and symptoms.
People out there, get involved. Next month is June. It's Alzheimer's Awareness Month. It's a big diagnosis. It's a big situation. Hazel, thank you so much for your time. We definitely have to have you come back.
You're very welcome. Yes, would love to.
All right, that's been Hazel Borden, Community Outreach Coordinator at Alzheimer's Association of Western and Central Washington. Alzheimer's awareness, and awareness is what it's really all about, Shannon, as we mentioned at the beginning of this segment, recognizing this and trying to get help for those who do have that malady.
Yes, absolutely. I mean, reach out. There are support available out there. You know, one of the things we know, Tom, too, is wellness, exercise, diet. They're finding a lot of interesting data on this and the maybe slowing down the progression of dementia and Alzheimer's with exercise.
Hazel, thanks for being with us. We'll get to our next guest right after this time out on Como.